All right. Thanks for joining us. Happy Wednesday. Welcome to the Direct Care Workforce Collaborative. This month here in April, this quarter, we're so excited you found us. And as Lori um, excitedly put in the chat, happy Direct Care Worker Appreciation Week. We're going to spend a little bit of time celebrating workers towards the end of this meeting. But if you don't know me, my name is Brooke Snyder. I'm a workforce and sustainability specialist within the Office of Community Living at the Department of Healthcare Policy and Financing. And I'll kind of be taking us through today's meeting. Yeah, we're really excited to get started. So just a quick overview of our agenda. We did have a quick addition later in the meeting. So if you got the agenda in an earlier email this week, it may look a little bit different for you. But we're just going to do some quick welcome and attendance and some polls. We're going to have an update on the direct care careers badging information. We're going to have an NCI State of the Workforce dashboard overview. We're going to have a quick update on House Bill 25-1328. We're going to spend some time again celebrating workers and some Direct Care Worker Appreciation Week celebrations. We'll have time towards the end for an open forum, and then we'll close out with our resources and surveys. So really excited to have folks joining us here. And I have managed to lose my mouse, which is perfect. Love that so early in a meeting. Just a little bit of housekeeping for us. We are recording. A lot of folks aren't able to join us in real time, so we do like to record these meetings and post them to our website after the fact so folks can catch up on things. And so that's just a reminder to avoid sharing any protected health information or anything you wouldn't like posted to our website. It just allows us to make sure everyone can keep a pulse on things and we are able to share it out. You are welcome to use the chat. I have several team members here helping me monitor the chat for questions, resources, anything you'd like to contribute to the meeting. We'd love to hear it there in the chat. You're also able to raise your hand as well. We typically have time for that and several opportunities to ask questions and share. Get the slides after the meeting. So we will be posting those to our Direct Care Workforce Collaborative website. And so I'm going to drop some links in the chat for us here. Typically takes about 5 to 7 business days for us to get that through the accessibility checker and get it posted to our site, but the slides will be posted on our website, which I dropped there in the chat. If you're listening by phone, welcome. Thanks for joining us. You are welcome to press *6 to unmute your line or *9 to raise your hand at any point to contribute to the conversation. I have turned on closed captioning, and you're able to manage that on your own screen on your black Zoom toolbar with the closed captioning, the CC box. And then more information about this meeting, as well as our action group meetings, can be found on our Direct Care Workforce Collaborative website, which again, I just dropped into the chat. We also have another website that I dropped into the chat for us, and that is just our workforce homepage. That's just a collection of all the work that our team does around the direct care workforce. So it's a great place to keep tabs on things. We're kind of continuously updating and adding information to that. So just kind of keep a pulse on the work that we're doing here. All right, let me keep us going here. If this is your first meeting, we love to do a level set and a welcome for you. You have found yourself in the Direct Care Workforce Collaborative. This is a quarterly meeting where we really spend a lot of time disseminating information and sharing updates around work in this space. We do have opportunities to get a little closer to the action in our action groups, and those happen every 2 months. So our next round of action groups will actually be in May, and that is training and career advancement, compensation and benefits, and value and awareness. We are stakeholder-led, HICPA facilitated, so each action group has 2 stakeholder co-chairs, and I'll give you an overview of who those folks are here in just a moment. Those folks help with agendas, discussion, topics. They really just make us make sure that we're keeping in line with the topics and information that are relevant to stakeholders in this space. So our stakeholders are all volunteer. We appreciate them so much, and they really just help us keep our focus narrow enough, but also helpful. So the purpose of this group and the action groups are really intended to reinforce the Direct Care Workforce Collaborative's purpose and vision, and that is really to share information and provide a space to collaborate and share resources related to this direct care workforce, and then those action groups can get you just a step closer if you have a specific interest in this area. Stakeholder voice is key. That's why we love to use our chat. We love to invite you to come off mute and share. We like to share the information out after the fact so folks can join us if they weren't able to be here in real time. And so we would love to hear from you in whatever way that makes sense for you. Just a quick overview of our leadership team. I know a handful of them are in the chat or in the room with us, so welcome to them. We have some great representation across different facets of this work, across the care continuum. So we have Jennifer Perez from Center Home Healthcare, Pascal Adu from SEIU Local 105, Ashley Weber is a nonprofit director and advocate. Britt Chavez works with Choice Home Care. Bobby Christensen is a job coach and advisor and also an advocate. And Galen Pereira is a direct care worker and advocate. So just some great representation across the continuum of care. And again, these are all volunteer roles, and these folks really just help us keep the focus and keep us moving in the right direction. So we really appreciate them. You'll probably get a chance to hear from them, whether it's in chat or an open forum kind of throughout the meeting. So. All right, I'm going to run some polls for us now that it looks like a handful of folks have joined us. Let me get those rolling here. I'm working on two screens today, so if it looks like I'm looking back and forth, it's because I am. So let me go ahead and launch this first one. This is which region do you represent? And so I know a lot of folks that join us, your work spans the entire state. And so if that's the case for you, just go ahead and report where you're joining us from, where you live. We'll give that some time. Give it just a few more seconds for folks. All right, that has stabilized. So I'm going to go ahead and end the poll and share our results for us. So we have great representation from our larger regions and counties along the I-25 corridor typically, but we do have some great representation from the southern part of our state as well. As typical in these meetings, our southwest corner struggles a little bit to get here. And so again, I know you've heard it before, but we'll continue to do outreach to these areas with our stakeholder co-chairs just to figure out the best way to get those voices heard in this meeting. And then the second poll is going to really identify how you identify on the direct care continuum. So how you're connected to our work, what brings you here today. And if for some reason you're not able to find yourself in one of those boxes, feel free to drop it in the chat and we can make sure that we're able to capture you and your role in future meetings as well. We can add a suggestion here. Give that just another moment. All right, that has stabilized for us. So I'm going to end the poll and share the results again. So good representation. We have some workers here today. Happy Direct Care Worker Appreciation Week to you. We have some members and family members of those receiving services, some advocates, employers, government agencies. Those are always well represented. So we're just really happy to have a great group of people here just across the entire continuum. So thank you so much. All right. So I think that's it for me for a little bit. So I'd love to hand it over to our first presenter, John Hendricks here with HCPF. John, would you like to introduce yourself and let us know what you're presenting on today?
Thanks, Brooke. My name is John Hendricks. I am the Direct Care Workforce Support Specialist. And what that means is basically I do everything related to the Direct Care Careers website. If you're not familiar with Direct Care Careers, it is a resource and job hub for direct care workers and direct care providers. Basically, it's a place where direct care workers can, they're not required to, but they can go on and they can post resumes if they're looking for a job. If they're not looking for a job, they can just use the resource side of the website. Employers can also use the job searching or employee searching side of the website where they can post job postings. and be automatically connected through a matching algorithm. So as soon as someone puts on either their resume or their job posting, anyone that those that the needs of those resumes or the work job postings fit with will be automatically matched with either job postings or resumes from folks. And then the other side of that is the resource side, which we have over 700 resources for direct care workers, direct care providers, and it runs the gamut from, just finding insurance for direct care workers, resources for direct care workers in their role, like how to transfer folks and things like that. We also have a lot of great, we have I'll plug this real quick since it's tax season. We have the direct care tax credit information on there as well. So we have tax information and where to get that help on there. And for providers, we have resources on how to, prevent burnout and things like that. We also have our learning management system, which is going to be mostly the focus of my presentation today, which has learning modules from the Colorado Direct Care training and foundational skills. So sort of those skills about how to create resumes and communication skills, and um, also career pathway modules to show folks who are a direct care worker, but they want to kind of move on to different work within that field, kind of what their options can be and where they can go and to get education. So if you want to go to the next slide for me here, Brooke, thank you. Back in, I would say, early autumn, we presented here at the collab and at all the action groups, asking folks who might be interested in helping us with a badge stakeholder group. And so we met back in mid-autumn, and our first meeting was to kind of discuss what are badges. So badges are basically little icons on the Direct Care Careers website. So if I was a direct care worker and I went in and I completed 5 training modules for that were associated with a specific badge, I would get that badge and it will show on my workforce, or not my workforce, but my workspace profile. So it's just really an easy way. So if I'm let's say I'm an employer and I've posted for a job and I'm looking for employees, it will show me really quickly like the modules and trainings that the direct care worker has taken. So the next step after explaining, kind of talking about what badges are, oh, and I need to go back real quick. So when we recruited folks for this, we really wanted people from all areas of direct care. So we were looking for educators, we were looking for CDOS employers, for agency employers. And so we were really happy that we got someone, at least one person from each of those areas to participate in this badging stakeholder group. So going back to where I was, I apologize. We brainstormed badge names. And so as a group, we kind of thought of what were sort of the basic categories that really lent itself to direct care work. And so we came up with 5 names. And from those 5 names, I then, after the meeting was completed, I gave everyone some homework where I sent them a spreadsheet, which had like all of the names of the badges we came up with all of the module names and basically check boxes. So if I was looking at um, our first badge name, which was homemaker, and I thought, oh, what is direct care work? That goes into being a homemaker. I would just check that box and then go through and do the same thing for all of the modules to associate them with different badges. Once I received all of those spreadsheets back from all the participants of the stakeholder group, I did what I called a badging consensus. So I basically looked at all of the badge categories and all of the modules that people picked for that badge, and they had to have at least a minimum of 3 votes to make it onto that badge from the category. And so once I did that, I went back and I had a list of um, modules that were associated with 3 or all 5 badges. Unfortunately, two of those badges, we only had one or two categories or modules to associate them with. So we kind of removed them from contention in this first badging stakeholder group. So that left us with three. And so we reviewed all of the badges and then looked at all of the modules under each one of those three badges. And we came to a consensus that yes, those badges and all of those modules that were associated with them made a lot of sense. We did run into a little bit, I wouldn't say of an issue, but CDPHE has very specific guidelines on what like say a homemaker is. Because we chose that name for that badge, we had to include required um, trainings that CDPHE viewed as being a homemaker. So we included those um, with the other um, categories or other modules that the group came up with. So we have to have those base CDPHE modules in there. So once we had done that, I had scoured the internet for different types of badges. So if you look at different learning management systems, each one has a different badge layout. So what I did was I took a variety, and some of them were very simple. Some of them were very complicated with a lot of sort of design features to them. And we, as a group, sat down and we looked at them, and basically, stakeholders said, told me which ones they liked and why they liked them, and which ones they didn't like and why they didn't like them. And so the consensus really came back that folks really like basic badges. They didn't want things with a lot of different types of colors or designs or things like that. So I took that feedback back, and um, at this time we were getting towards the holiday season, so we were not able to hammer down a really good time for all of us to meet. So I asked the group if it would be okay if we just looked at the badges through emails, and everyone was acceptable of that. So I created um, a badge demo and sent it out to folks and had them vote on it. And once they gave me their feedback, I created the badges, and then we made sure that they were accessible. Next. Thanks, Brooke. So the first badge, getting into it, was the homemaker badge. So to get the homemaker badge, as a direct care worker, I would need to go on to the learning management system and complete and pass all of the modules you see here. So passing is 80%. Like all of these have a quiz at the end. So if I get over an 80%, I will pass that quiz and I'll get a certificate. And then if I pass all of these, then that's when I would get a badge that would show on my workspace. So for a homemaker, we would have to complete legal and ethical issues, observing, reporting, and documenting, reporting or working with members in their homes and communities who are direct care workers. So pretty basic stuff so far. And then HIPAA and member confidentiality, infection control across work settings, member safe member mobility and direct care worker body mechanics, basic first aid and for the direct care worker, handling emergencies as a direct care worker, what your role is as an employee, communication, challenges in caregiving dynamics, talking about disability, cleaning procedures for the direct care worker, managing member errands, appointments, and shopping, nutrition planning, preparation, and assistance in general household duties as a direct care worker. So if I was a homemaker, these are like the basic things that I would need to know or the trainings that I would need to go through. But if I do all of them, I will get a badge. And that is like really beneficial for folks. We think, especially for employers to see what trainings, quickly see what trainings have been completed. And the homemaker badge, if we could go to the next slide, is this right here. So this is the design we came up with, the colors that were accessible for it. So on the website, the badges are not going to be this big. They will be a lot smaller. So once we get to that point, we'll adjust them for size and all of that good stuff. So that was the homemaker series of modules, and this is the badge. And if we go to the next slide, we have the personal care badge. So the second badge we came up with, which was personal care. And again, this has those requirements from CDPHE that there are basic trainings that have to be done to be considered personal care. And if you look at this list, it's very similar to the previous homemaker. So we kind of wanted to do it like a step. So um, to get the personal care badge, you would have to only do a few more badges or a few more modules to get that badge from the homemaker badge. So I'm not going to go through all of these. I'm just going to point out the modules that are different from the homemaker badge, which are care and support for older adults, common age changes, care and support for children with disabilities. And if we could go to the next slide, please, Brooke. And this is what that badge looks like. So same design, just a different color. And we wanted to make them different colors so that if someone was looking at this on the My Workspace page of a direct care worker, they'd be able to easily identify the differences. And if we could go to the next slide, please. Our last slide, our last badge that we came up with was Direct Care Essentials. So these are just basically, if I was a new direct care worker, what would be basic first things that I would need to learn in my role? And so we came up with infection control across work settings, handling emergencies, basic first aid, talking about disability, observing, reporting, and documenting, building your skills as a professional, ethic and legal issues, who are direct care workers, working with members in their homes and communities, wellness and self-care for the direct care worker, your role as an employee, and challenges in caregiving dynamics. And if you could go to the next slide, we'll show you our badge design for that. So we went with blue for this one. And yeah, so what we are going to ask you to do next, if we could go to the next slide, please, Brooke, is we have a link to a survey. And this is just basically feedback from you all based on what I've just presented to you. Like, what did you think about the badges? Do you think this is going to be helpful for folks on the website? And then once we get all of that information back from you all, there's about 8 questions on that, I should say. So it would take probably maybe 8 to 10 minutes to complete. Where once we get that feedback from you all, we'll do an internal review, and we'll look at your suggestions and change anything to reflect those. And then once we hammer down everything and finalize the modules and all of the badges, we are going to add the badges to the live site to start being used by direct care workers. And I just want to plug one thing just for you all to know. We did surpass the 10,000 completed modules on the website just this past weekend. So people are using the trainings and getting a lot of things done here. And so I think the next step in this is to get these badges put on. I would also like to put in a plug as well that these will not be the only 3 badges that we have for the website. We will be doing another stakeholder group in the future where we're going to add more badges. So if you're interested in being a part of that, feel free to email our general email and let us know that you would like to be a part of that. And when we get to the point where we're going to be adding new badges and looking at, what badges we want to add with the stakeholders, I'll reach out to you in email and send you an invite. That's the end of this presentation. Are there any questions at this point? Is there anything in the chat for me there, Brooke?
No, Lori just says, great way to recognize direct care workers' accomplishments and skills.
Great. Thanks, Lori.
And we'll just, Bobby makes a note, good job, color and accessibility. Love that.
Awesome. That was all stakeholder feedback that you guys gave me. So thank you for that.
Jen Oaks has a question, please.
Yes, Jen.
Just confirming it was 10,000 people taking the trainings.
So not 10,000 people, but 10,000 trainings have been completed. So people are taking multiple trainings.
Wow,
but yeah, it's
cool.
still quite
That's
impressive.
a good number.
Yeah, thank you.
Mm-hmm.
And we'll just kind of wait for folks if there's any additional questions. But John, I do have a question, just since we are talking about 10,000 completed modules. What happens if a person has been on DCC for a significant period of time and maybe they've taken these packages. Did they get like retroactive badges? Is that kind of what we're planning, or what does that look like?
Yeah, absolutely. So all of the completion certificates are stored on the website. So if you're a direct care worker, as we know with the direct care work, you have to do so many trainings and you get a lot of certificates for all those trainings and webinars and things. So the direct care careers website was really designed to be like your central housing for those. Because if you have some that from outside of the direct care careers website, you can actually import those. So you can just download them and have all of your certificates and all your information in one spot. But going back to your question, Brooke, everything is saved in there, all of the completions, all of the um, modules that you've taken. So once we put these on, some people might automatically get badges and not even, realize that they've completed it all. So yeah, that will definitely be retroactive.
I love that. Looks like we have a question from Tom. So if a potential employee has a badge, an employer would not need to do additional general training. Obviously, person-specific training would still need to be done. I'm not sure if you or Heather can speak to that.
Yeah, so I would say, oh, you could
Yeah.
go ahead, Heather.
Oh, sorry. Yeah. Tom, I was just going to put something about that in the chat. So we have been talking with CDPHE about the portability of the training, and um, so they have come back with chapters 8 and 26 do not prohibit transferring portable training, right? So the training can be portable, and it is a kind of exactly what you just said is each facility or agency is responsible for ensuring the competence of the individuals providing the care or the services, and that's generally done through observation. Um, so agencies are still going to be responsible for making sure that their workers are competent in performing the skills, but they can accept this training as that training with that certification of completion, as part of that process. Now, not all trainings require competency, but some do, and so the agencies will still be responsible for that, but the training is considered portable. So if I come to work for you and I bring my training certificate saying I've completed all these trainings, you can choose to accept those trainings and then just do the competency aspect to make sure that I have the skills needed, and then also the individual training that would need to be done to support the members that I'm working with. That would be on the agency as well.
So as people are thinking of any more questions, if we could go to the next slide. Oh, and you already did. Oh, no, you did. There we go. Thank you. Sorry. So yeah, again, here's our contact information. So if you're interested in being part of future badging work groups and creating those with us, go ahead and send us a line at this email address. And if there are no other questions, I'll hand it back to Brooke. Oh, I can't hear you, Brooke.
Can you hear me now?
Yes.
Perfect. Okay. Thank you. So sorry about that. So I did just want to say we are just a few minutes ahead of schedule. So I'm going to drop the survey in the chat one more time. And we may just kind of let it sit for a little bit while it's fresh in your mind. I'd really encourage you to hop in and take that survey. I do see we have another. It's just Heather following up with some specifics on the question that Tom had, just some specific questions or information related to that question. So we'll make sure that that gets captured in the notes as well and sent out for you to refer back to in future meetings. So let's just maybe take a moment. I see it's 10:30. Maybe let's come back together at 10:32 and move forward. But I'd really encourage you to just take a few moments to open that survey while it's fresh in your mind and give John some good feedback. And John, if it's okay while folks are doing their survey, I'm going to keep lobbing questions to you as they come in.
Yeah,
So
absolutely.
Lisa is wondering, can a host home use the Direct Care Careers website to post a job out of their home?
So yeah, any provider can use the direct care work website so long as they are HCBS providers. So there is sort of a verification wall that providers have to get through. So if you are a waiver provider, you will be in our reports, and you can go in, and what we would need from you is the name of your organization, your tax ID number without any dashes, and your zip code. And once you put that in, you will be verified automatically through the system. It usually takes just a couple of minutes or seconds, really. And then you will be able to access the site for sure. Yes. Yes, Lisa. DD waiver is okay.
Perfect. Thanks, John. And Lori asked if there's a list of badges and content available to review for reference. I'm working just really quickly on putting together just some slides that I can drop in the chat of just the badges and the classes, or the modules, excuse me, that folks can look at. So if you give me just 1 second, I will have that for you.
Thanks for doing that, Brooke. I assume
Yeah.
signing up on the website would give me that access, but that's not, I don't want to do that in my role.
No, that makes sense. That makes sense.
Thanks.
Yeah, and there's a lot of modules associated with each, so thank you.
All right. So I just dropped a copy
I
of
was-
the slides.
I was going to say, Lori, perhaps a workaround for that. And Justin, if you could maybe drop the link to the training page. We do have one pagers, I'm sorry, that give the basics of each of the modules that are available on the DCC, and they're kind of sectioned out by the Colorado Direct Care training modules and the foundational skill modules. So you can pick each folder, and it'll give you like the just a real quick summary of it and the learning objectives for each of those modules in there. And so that's a way where it's it's not behind a login. You can go and check out what the modules are,
Perfect.
what their
Thanks,
content
Heather.
is that way. Sure.
Yeah, and I do those slides that you posted, Brooke, are really helpful too. Thank you.
Perfect. Like that's my workaround to not do the whole slide deck out, so I can still go through my accessibility checks, but I can give you what you need. So all right. And it looks like Justin is dropping the one pagers in there, which are super helpful. Those are helpful outside of the badges too. So just one of the things we've added in the last couple of months for folks. And so, yeah, be sure to check that out. All right. So I feel like we've given folks a little bit of time to do the surveys. And if you're not able to finish the survey during the meeting, at least you have what you need to go back in and do it. So we'll make sure that remains open for you for a bit, and we will keep it moving. At this point, I'm going to turn it over to Jen Swaysgood here at the department to give us an update on the NCI State of the Workforce dashboard. And Jen, I'm going to quit sharing, and you should be able to take over.
Perfect. Thank you. Bear with me for just a second as I share my screen. There we go. All right. Is that visible to everybody?
Yes, we can see it. Thank you.
Okay, perfect. All right. Well, thank you for having me today. My name is Jen Swaysgood. I'm a policy advisor here at HCPUF. And I'm going to be talking about the Home and Community-Based Services Quality Dashboards. So we do participate in member and worker experience surveys, and we have since 2013. Currently, we use 4 surveys, so the National Core Indicators Aging and Disability Survey, the National Core Indicators Intellectual and Developmental Disability Survey, the Children's Waiver Satisfaction Survey, and the State of the Workforce. And the State of the Workforce is the one that I'm going to be focusing on a little bit today. So, State of the Workforce survey is administered on an annual basis. We've been participating in the administration of this survey with the intellectual and developmental disabilities since 2018 and aging disability survey since 2021. The goals of the survey are to help Colorado describe the workforce, measure any challenges, and monitor for improvements. For the survey, direct care workers are defined as providing support to HCBS members with intellectual and developmental disabilities, aging and or disabled adults, and to help them live fulfilling lives, make choices, and live and work in the community. For the purposes of this survey, the direct care workers included are all people whose primary job responsibility is to provide support, help with skills development, guidance, or personal assistance at any location or during any activity. That's at home, leisure, work, etc. And this is to adults. All full-time and part-time direct care workers, and all paid staff members who spend at least 50% of their hours doing direct service tasks. So agencies are the ones who fill out these surveys to provide this information. So the agencies who are eligible to provide it are those who provide services to members enrolled on the developmental disability and supported living services waivers, and agencies who provide services to the elderly, blind, and disabled, community mental health supports, complementary and integrative health, and the brain injury waivers. So these are all of our adult waivers here in Colorado that we offer. There are some workers who are not included in this, and those are clinically licensed staff, so therapists, nurses, etc., behavior specialists and techs through BCBA, those who only provide transportation, home modifications, and or meal delivery services, contract or 1099 workers, on-call or PRN as needed workers, staff hired through a temporary personnel agency, administrative staff or supervisory staff unless they spend more than 50% of their time doing direct support work, nursing facilities, and self-directed direct care workers. So participating in these surveys allow us to meet the mission and goals of HCPF, such as understanding member experiences with HCBS, addressing gaps to improve programs, and ensuring quality of services and outcomes. The goal of the State of the Workforce Survey is to help to describe the Colorado's workforce, to measure challenges, and monitor improvements. So what we wanted to do was find a better way to share out the information that we gather when we do these surveys. So we developed a public-facing interactive dashboard that exhibits state of the workforce respondent data by creating a comprehensive picture of the direct care workforce across Colorado's HCBS programs. And we'll use this data to highlight the direct care workforce experience in Colorado with information about benefits, vacancies, wages, etc., in an interactive and accessible format. The information contained in the dashboard meets all privacy standards, so information data will not be shown for fewer than 30 participants. And connected to the dashboards on the website is an accessible version of the information that's here. So there is a document that provides an alternative way to access the information that's in the dashboards. And this document is accessible with keyboard navigation and screen reader software. So we hope that that makes it able to, for that. All right. Now I think I'm just going to give a little demo and show what the dashboard looks like and how to kind of walk through it. And see if this will work when I switch over to this one. Let's see. Is this still visible, the dashboard now?
We still see your slide.
Okay, let me go ahead and stop that share, and I'll share. There we go. All right. Okay.
Perfect. Yes, we can see it.
All right. So this is the State of the Workforce dashboard. There are 4 dashboards, one for each survey that we administer. And this is kind of the landing page. When you first come to this page, you're going to have this overview page, which has an introduction, which is going to talk about the specific survey that it is displaying for. So this one's going to have information about the State of the Workforce survey. It's going to have some like details about it in the website to get to it. There are some accompanying links that provide other areas you might be interested in looking at. Designated service areas just talks about the 20 service areas that are in Colorado. And then there are some limits and caveats to the type of work that's in here. One particular one that we like to note is that the sample size in 2019 and 2020 were significantly smaller. The sample sizes for the survey's year 2021 through now have a much larger representative sample. So, and then my contact information is here at the bottom. When we're walking through this, I like to kind of go over here to the left to the menu and just kind of go from the top to the bottom. So the next one I'm going to click on is the designated service area. This is going to open up a map of Colorado and the 20 designated service areas or defined service areas, you might hear it called as well. With this, you can kind of see if you're interested in knowing what the county you live in, which service area that is, or if you have a loved one who lives in a county, which service area are they. So there's a couple of different ways you can look at this. You can hover over your county. So let's say you live in El Paso County. You can hover over it, and a little text box is going to pop up and say that El Paso County is part of Service Area 11. If you hover over to Eagle, you'll see that Eagle County is part of Service Area 15. So you can do that throughout here and hover over. Or if you want to isolate just one particular service area and you want to know which counties are in Service Area 4, click on that and it's going to highlight Huerfano and Los Animas down here at the bottom. So this is just a way to be able to filter later on if you want to look at something specific to where you live or where somebody that you might know lives. All right. This is one of the pages, some of the survey results. First here on the left, you've got a few different ways to filter. So we've got all 5 years of survey here that you can select through if you want to. We've got all of the designated service areas as options and agency size. Now, if you want to just look at the area you live in, let's say you want to look at the county you are in, you can deselect through here on this box, and you'll see that it'll pop up with this thing saying that you're less than 30 participants and it can't be displayed, so you just need to add a few more parts to it. So I'm going to say I want to look at service area 5. And it will pop up because now we're above that 30 threshold, so we're able to show it. But for the purposes of looking at this, I'll just select all of them. All right, so we pulled out certain questions from the survey to share out some of those results. So you've got vacancy rates, turnover rate, hourly wages, and types of supports. What we can do with this is you can kind of take a look at it as it is, or you can say, you know, with vacancy rates here, I only want to see the information for Colorado full-time and national full-time and see how they compare. So you can do that by clicking on the ones you're not as interested in. So you can click on national part-time. That one's going to go away, and Colorado part-time, and that leaves you with just the information you wanted to see right off the bat. Now, some of these graphs and tables can be a little bit small. So if you want it to be larger, you can go up here to this little icon. It's 2 little arrows, and it's the maximize button. So if you maximize, it will show you the larger version of that. And you can still interact with it. You can still change the view, add or take away the different things that you might be interested in. And then if you hover over it, it'll give a little description of each of those. And then when you're done with that, you've seen what you need, you can go back up to the top right corner and there's going to be those little arrows and that'll take you back to the main page. And you can do that with any of these to see these a little bit better. Like I said, some of them are a little small, but easier to kind of see what they look like as a larger version. All right, the next section is a snapshot of the direct care workers. So you'll see some of these larger numbers on the side. These are some data points that we pulled out because we thought they were interesting or might be interesting to members and direct care workers who might be looking at this. So just kind of easy things to look at. If as you hover over, you'll see that there's a little description of what this is about. And then same thing with this. If you want to look at any of these a little bit closer, you can pop those out, take a look, move through the different ones, and go back that way. And the final page for this is the direct care worker health benefits snapshot. And this is benefits that are offered to some or all direct care workers. We have 2023 and 2024 data up here. And what this shows is the Colorado average and the national average and kind of what the difference is between those. So you can kind of look through and see where Colorado might be ahead of the average or might be behind the average a little bit, and just kind of gives a snapshot of what's going on with the direct care workers and benefits. So that is the end of this and kind of the end of what I was going to present. Does anybody have any questions?
We do have one from Rosemarie. Is the average hourly wage an average of skilled and unskilled wages for direct care workers? And that might be a question we have to take back as well, just to see where that's pulling from.
I'm going to ask Rachel if she has an answer, and if not, we can take this back and find out.
Okay, perfect.
I'm here. Hi, guys. It's me, Rachel. Skilled versus, wait, so the question is, does it include skilled and unskilled, or?
Yes, yeah. Is the average hourly wage an average of skilled and unskilled worker wage?
I'm going to say it incorporates skilled and unskilled. So the way that NCI works is it just requires that the agency provide services to a certain set of services. And then if they do, then they qualify to participate in the survey. And then it just takes that average hourly wage from that agency to come up with that. So it doesn't split it out, if that makes sense.
Yes.
That's my long way of saying yes.
Heather, please.
Rosemary, I would say if you're interested in just specifically like HCBS, which would be the base wage services, I don't like to use unskilled because it is a skilled job, but I understand what you mean, like whether it's a certification. You can look, we do have our base wage report posted on our website, and we are working on getting the 25 numbers up shortly. So that'll at least give you the idea of what the average wages are for direct care workers operating within the base wage services. And we do have it by worker or by service type, so homemaker, personal care, respite, and also by county. And we can drop the link to that report in there as well if you're interested.
Thank you, Heather. And Rosemary says thank you. So I think that link would be helpful for sure. Jen, I do have a question, and it may be to be determined. Can folks or providers specifically, are we continuing the NCI survey? Is that something they can expect to get questions on later, or are we kind of switching gears on what that looks like for us?
So we are switching gears a little bit. It's still going to be a lot of similar information. It's just a different format. So it is the NCI State of the Workforce survey currently, and the one that will be continuing is the Workforce Reporting and Base Wage Attestation form. So using this form, we'll be able to look at information from an intellectual developmental disabilities versus aging and disabled, and a few other ways that we can compare information. But yes, it'll be the Workforce Reporting and Base Wage Attestation form. So same type of information gathering, but it'll just look a little bit different.
Perfect. Thank you so much.
Mm-hmm.
Any other questions for Jen? I see Heather has dropped the link to the 2022 through 2024 HCBS base wage report, and then also the base wage website as well. And Heather, I don't know if your hand was from before or if you're still just, okay. I was like, you're ready to roll. Let's. All right. Well, if there's no other questions for Jen, we'll let you off the hook for today. And thank you so much for the demo. That was super helpful. And
Thanks, everybody.
yeah, that sounds great. And I just like to point out, I know Jen mentioned it, but on the dashboard itself, her email is on the link to that dashboard. So if you get in there and you end up having questions about it, I'm sure she'd be happy to answer those for you. And I will just drop that in the chat one more time. And yeah, thank you so much. This is great. All right, I'm going to get our slides pulled back up here. And I apologize, I'm scrolling to get back down here. All right. And so at this point, I would like to move us into our next agenda item, which is a House Bill 251328 update from Heather Johnson. Heather, please.
Thank you. Just kind of bringing this to folks' attention as there are some looming dates where things will have to start happening. And so House Bill 251328 is also termed as concerning the implementation of the recommendations made by the Direct Care Workforce Stabilization Board. The Stabilization Board did some public hearings, I would say 2 years ago. And so the feedback they got from workers, and they went across the state, that helped inform some of the stuff that they have requested in this bill. And there's a few different parts on here. So if we go to the next slide, one of the requirements of the bill is that all workers will have to take a Know Your Rights training. And so it's a free standardized training. Colorado Department of Labor and Employment, CDLE, are tasked with creating this training. And they have been doing a version of this training before. They were hosting some hours and doing some Zoom trainings. And CDLE does have a lot of the videos and resources already on their website for this. So there is information out there, but now this is taking that information and making it required. The training has to cover base wage and overtime rules, paid leave laws, travel time rules, civil rights protections in the workplace, and how a worker could file a complaint and get help if they needed to. And so what providers need to do, which is important about here, is to ensure that all their direct care workers have completed the Know Your Rights training by October 1st, 2026. And I put an asterisk there because the bill does, it has, or 90 days. It has a couple different timeframes in there, but I think it's important just to kind of keep that in mind. And then providers would need to collect proof of that completion. Right now, our plan is that the CDLE training will live on the Direct Care Career site where the other trainings and John had just talked about will be. And that training, that site provides a certificate to the worker of that training. And so the ongoing requirement would be if you are hiring new workers that they either have to take that training or show you proof that they had that training. So then it is not needed again. And Carrie has her hand raised up, and I'd love to give this to her because it's really her. This is her section.
Hi, yeah, I'm Carrie Chesney. I work with the Division of Labor Standards and Statistics. You did a great job presenting that. That's pretty much true, everything there. I will say our original training doesn't include all of these kind of new requirements. We have things like what's listed here, like civil rights protections. My original training that's on our current website doesn't have that. We're creating something new for that. We're going to be adding in some of those requirements that weren't in our original training. And also, as far as proof of completion goes for employers, it's gonna be a digital certificate. So we'll take things like screenshots as proof for that kind of thing. So just know that you have to have some form of proof that yes, your workers have taken this training. And going forward, new hires will also have to take the training, or they'll have to show you again that they have that certificate. And note that it's outlined in the bill that it is under the Division of Labor Standards and Statistics purview to audit for that if it comes up. Now, generally for us, it's, we get tips or complaints, so formal complaints that come in. So
Looks like we do have a question from Jalissa. Do we have to take the training through your portal that gets the certificate, or can we incorporate this training via our own orientation training?
The bill says it has to be the CDLE training.
yeah.
Thank you for the clarification.
Yeah, all
That's
right.
helpful. That's a good question.
All right, and if you want to go to the next slide, I have a little bit more on what providers need to do. So there's a couple more parts of the bill. Another part of it is distributing a direct care worker notice of rights. This is something that we at HCPF are developing in coordination with the Direct Care Workforce Stabilization Board. I'll call it a one-pager. It's probably going to be front and back, but we're trying to keep it to that. So employers would need to provide this to their employees. The worker notice itself, it'll cover what the Know Your Rights training information is. It'll talk about the direct care worker website, which earlier I mentioned we had training one-pagers on it. We also shared a link to the base wage. So we have a direct care worker website that has a variety of different options on it, and we're working on a resource one as well. So it'll tell the contents of that website and also the direct care careers, which we call the DCC platform. It'll tell folks how to use it. And it really is just like what the options are on the DCC. And John did a really good job of explaining that. You can use it to look for a job if you're a worker. You can use it for resources. You can use it for training. And also you just get updates from that. John will send out updates. It's just a way to kind of stay in touch with that. I'm just speaking from the worker lens here on how to use that. And they'll also on the workers on the notice, I'll tell them how they can opt in to receive additional updates. It would be from the Direct Care Workforce Stabilization Board. At HCPF, we would send everything to everybody. But the opting in is you're like, I'd like to get specific information from the board. And so those could be things about potential changes to workers' rights benefits. It also allows the worker to share their name, phone number, and email with some defined organizations. And that would be CDLE worker organizations representing direct care employers and consumers. And so workers will have an opportunity to opt into that additionally when they sign on to the DCC. So that's what the one pager will be. So there's some important reminders on this. CDLE, and as Carrie mentioned, shall enforce compliance and impose fines on providers who are on violation. You can find some more of that in the bill. And also back to the question, employers must use the CDLE Know Your Rights training. And another important thing is direct care workers must be compensated for the time spent on that training.
Carrie,
Okay.
please.
Yeah, just so you know, the fines are $100 per violation, so just be aware that that is what is listed in the bill. And CDLE will try and work with employers who are attempting compliance, right? So we're going to give you some grace as long as you are attempting compliance with the law.
So just in closing out here, I would say if you haven't already signed up for the DCC, go in and check it out. You'll be familiar with it. You'll know how to navigate some stuff as an individual user. We do not restrict who signs up as an individual user. We typically call them workers. We know they're not all workers. It's family members, it's natural supports, it's community members that are interested in stuff. So you're welcome to sign up as an individual user and explore the site. And as John mentioned earlier, we do control who signs up as a provider on the back end for posting those jobs. And that is really just to protect the sanctity of the site and to keep it less scammy. So those have to be providers operating in our space. And that way we can filter for making sure they're including the base wage in there as their minimum base wage. It's a little safety on the site. So HCBS providers, PACE providers, you really have to be in the Medicaid space to be on as the provider side. But we do not restrict who signs up on the user side. And that is all I have. I didn't see any other questions. And we'll continue rolling out some information when we have some more set timelines. And we're kind of just trying to build it and let it go ahead of time before calling it out. So like you'll see the training information is already up. That's part of this bill. But we've already developed it and put it out there because it has multiple uses. So stay tuned.
And I just want to call out a couple things in the chat. Pascal will receive this presentation to add to our blog or share with workers. I think that's an important point too, is we're doing a lot of information dissemination for the provider piece of this, but like also considering making sure that workers are aware that this will be a requirement as well. So Pascal, I think maybe as co-chairs, we can come together and figure out the best way to get maybe the one pager out to workers ahead of time as well, and post it to our story sharing blog and things like that. So I certainly think there's an avenue there to do some additional outreach to make sure workers are aware too. And then Heather, or Carrie, Cindy has a question. When will the training be ready for direct care workers to attend? She apologized if she missed that.
Yeah, so we're still working on that. It's going to be an online module, so I'm having to work with another team on it. We're hoping right now our estimate is we're going to get it up by late July. So our deadline is in between basically like July 1 and October 1, right? So we have that sort of time frame. I mean, we definitely want it up by August. I mean, we'd like to get it up by August, September. So you guys can be compliant. But hopefully we'll get it up by that first date, which is late July. That's our hope.
Perfect. Thank you, Carrie. And thanks for the question, Cindy. I will say that we have a collaborative meeting in July. And so perhaps, Carrie, we can work with your team to bring you back and get some updates closer to that deadline as well.
Yeah.
Julissa has a question. Will each user need a login to complete the training? I'm assuming for direct care careers.
Yes, in order to sign up to access the site, you do have to log in, and you would need that to do the training, and then that's how you get your email certificate emailed to you for any of the trainings you've completed.
Yeah, and I would just like to add, if you're a direct care worker, you're not looking for work right now, you can go in and as you're filling out your information, you can actually select a checkbox that says like, I'm not looking for work, and just use the website for all of its resources and all of the training. You'll still get, you can also select kind of your notification preferences. So if you want notifications from the website, you can put those on there for daily. Usually you just keep them at weekly, and it'll tell you when there's new trainings available and when new resources are added. And I do add new resources at least 3 to 4 every week.
Awesome. Thank you, John. That's a good clarification. I think that folks don't have to be necessarily using that job search piece of it. All right. Any other questions for Heather, Carrie, John? All right. I think I will keep us moving, and we'll continue again to keep pulse on this since we have a bit of a long runway. As Heather said, we're really trying to get the information out ahead of time. And so we'll continue to check in with this group and also the action groups as information kind of becomes available for us. And at this point, I'd like to take some time to celebrate during Direct Care Worker Appreciation Week. And so if you are new to our group or to the last couple years, we have been celebrating Direct Care Worker Appreciation Week since since 2023. We probably started the proclamation in July of 2023 in order to get it done. But we spent a lot of time working the first year on a governor's proclamation, which was incredible. It was a great way to get this on the calendar, but it took a little bit too much time for us, and we didn't know exactly when it was going to come to fruition. So instead of doing a proclamation every year, the leadership team decided to seek a joint resolution with House legislation. So we have a joint resolution that calls out in the state of Colorado the first full week of April every year is our Direct Care Worker Appreciation Week. And so this year it is April 5th through the 11th. And if you're like, oh my gosh, I forgot about this or I didn't know about this, that's okay. It's only Wednesday, and you still have a couple days left to celebrate. And so we have a media kit that we have put together that I'm going to drop in the chat right now. That media kit will give you social media options you can use, letter templates to send to your local newspaper, your local officials, your legislators. Just a lot of great information on ways to celebrate and bring awareness to this workforce. And for this specifically, we have put together a little slideshow. We had opened up a virtual round of applause where people could come and fill out a Google form and give shout outs. to workers specifically. And we also collected just a handful of social media posts that we found throughout the week on the website. And so we would just like to put together this little slideshow for you just to celebrate workers and give a shout out to the great work that they do. We want to celebrate them every day, but especially during this week. And so if you'll give me just a moment, I'm going to get this pulled up for us and make sure I have everything I need. This should have some sound. And so again, give me just a moment. All right, please enjoy. All right, so that was just a quick little smattering of what we were able to find across the web. We honestly hope that we'll see more posts coming through the rest of the week. And if folks continue to fill out the virtual round of applause, we'll make sure that those are showcased on our blog, which I'll drop the link in the chat too. As well, we do have a story sharing blog that this group has been using for the last several years, so you'll see some posts on it as well. But yeah, we're pretty excited that folks are taking the time to celebrate workers in a way that feels doable to them. And so let me drop that link to the story sharing blog in there. The virtual round of applause, all of that can be found in the media kit. So we, again, encourage you to keep using that and really celebrate the rest of the week for our workers. So if you're a direct care worker and you're joining us here today, thank you so much. We appreciate you. We see you. And we hope that that at least made you smile a little bit. So let me get us pulled back up here. All right. Um, Great timing, right? Let's celebrate workers. And then also I need you to fill out a survey for me. But we do just like to provide a link to our feedback survey. This keeps us on track for future meetings. It allows us to understand if your time is being well spent here in these meetings, any topics you might have or information you're looking to get from us that maybe we're not providing. And so I do just like to drop that before folks have to leave at the end of the meeting there. So there's our feedback survey. It should take no more than 60 seconds. If you have time to complete it, we'd really appreciate it. Again, it just helps us make sure that this meeting continues working for you and that this is time well spent for you in whatever your capacity is connected to this work. So at this point, I'd really like to move us into our open forum. This is just where we spend the last 10 or so minutes before resources. And I really open the floor to folks to be able to share information, resources, ask questions. We really just open the floor to attendees to use this time as they see fit. And so I will give folks a few minutes to come off mute or drop it in the chat. And if there are none, then I'm sure our team has a few we can muster up for you and get you out of here. So the floor is yours. And like I said, I'm sure our team can come up with something. So I like to come prepared. I do just want to give a special call out to some upcoming webinars that we have in our office, and then also just like around budget and sustainability webinars with all the federal and state changes and budget information. The Office of Community Living will have a budget and sustainability webinar on Monday. And so if you'd like to sign up for that, we have the link to that. That I will drop in the chat. And let me go to the chat really quickly, and we'll come back to that. Lisa, we would love for you to introduce yourself. Would you like to come off mute?
Yes, yes. Am I off mute?
You are off mute, and the floor is
Yes.
yours.
Thank you. I just wanted to introduce myself. This is my first meeting. And as a parent and as a person who is a regional health connector, I really appreciate all that you do. The program I am working on in Douglas County is for parents and caregivers, any age, any ability, that kind of program. So far, I've been doing this for about 6 months. I have started a free yoga for parents and caregivers at Advent Health Castle Rock once a week, as I just personally had really good experience with that, as I needed more support than a lot of what I was finding out there traditionally as a parent. Also, I'm not sure if you guys have the Bell Policy Center survey. Yes, wonderful. Okay. So I'm looking pretty strongly at the mental health. And then also, just me personally as a parent, just received note yesterday, or actually the day before, that my daughter has been denied her 23 hours of nursing through Medicaid. So for all of us parents and caregivers, we got to hang tough. So anyway, that's all I have. And I can let you know, Brick, my contact information, if that's okay, later after the meeting.
Yeah, that would be great. If I can have one of our team members drop our email in the chat, Lisa, if you want to send me an email, I can get you added to all the listservs if you're not already connected.
Wonderful. Yeah, great. Yeah, I've been trying to navigate this, and so thank you. I appreciate it.
We have just a few meetings here at the department, just a few. And then Lisa, too, if you have
Thank you, everybody.
If you have a website specific to what you're doing at Douglas County, I'd encourage you to drop that as well so folks can see kind of what you're up to and maybe get some ideas in their own areas. So thank you for introducing yourself. We really appreciate it.
All right, great, thank you.
Thank you. And then Renee Walker, just maybe a comment. Our agency represents 3 areas and you only let us choose one. So the data for service areas isn't going to be accurate unless you open these up for all. Thank you, Renee. That is helpful. I can change, if you're talking about the polls in the beginning of the meeting, I can change it to where you can check all that apply. And so I can make that edit before the next meeting. But if you want to drop the other 3 areas in the chat for me, I can make sure that I get those in this month's information. And then Pat, I'm assuming you're talking to Lisa. If you call me, I can explain and help you resolve. Most of them are process issues and not functional denial. So Pat and Lisa, sounds like y'all can connect and get things going there. So thank you, Pat. I appreciate you offering to help. All right. John, please, yes.
Yeah, I just wanted to give some updates on the CDOS employer sign up on the website. What we had heard, we got some feedback from CDOS employers that they were having trouble finding their PALCO or PPL ID numbers. So what we did over the last few months is worked with both PALCO and PPL to make those ID numbers more accessible and easier to find. So we've changed our login. So if you're a CDOS member and you tried before and you weren't able to get in and never finished getting signed up, please go back and you'll be able to hopefully find your ID numbers a little bit more easily. We have links to both instructions from PALCO and PPL to find those ID numbers. And also, if you're not able to find the ID numbers where they are suggesting they're located, we also have 3 different forms of contact for both PPL and PALCO on those updated instructions.
Perfect. Thank you, John. That is helpful. All right. Looks like we're exchanging some contact information in the chat. That is great. And okay, so I did drop the link to the OCL budget and sustainability webinar. That is next Monday. That is a good place for just to come together and kind of see the state of everything and figure out kind of what's going on in this space. I did want to note that we have a couple action groups in May. May 1st is a training and career advancement action group, and May 15th is that compensation and benefits action group. I don't have specifics yet, but we are currently working with our HR1 stakeholder engagement team to hopefully have some information related to HR1 in those meetings, kind of as it relates to our workforce and maybe some stakeholder opportunities. So once I have more information on what that's going to look like and who they're looking for and what information they'd like to share, I can get that out to y'all. But just something to keep in mind for that May 1st meeting. And then the May 22nd meeting of Value and Awareness is canceled. It's the Friday before Memorial Day. And so we figured might as well let folks kick off their summer a bit early and canceled that meeting. And then we don't take, the action groups do not meet in July. So we take July off. So that's just some upcoming webinars and information from our end. And I do like to offer up the topic request form during this open forum. This is if there are things you would like to see in future meetings. You can drop a topic request in here. This is twofold. You can request that we go out and find information on a topic that you want to find more information about, or if you are a presenter and you think you have something that would be super helpful for this group to know about, you can also submit that form and say, hey, I'd like to present to the group. Once you fill out the form, I'll take it to our stakeholder co-chairs, and we'll just make sure it fits within the parameters of this meeting and is helpful. And then we'll reach out and get that scheduled for you. So a great way to get some topics that you might be interested in on future meetings. So typically we need about a month's time. So if you're looking at something you'd like presented in July, try to fill that request form out maybe in June for us, or the sooner the better. Renee, which link are you having trouble with? The one on the screen for the topic request form? Yes, okay. It's the one posted right above your chat message, but I'm going to drop it in one more time for that topic request form. And then when these are posted on our website, all these links will be live, but since I'm screen sharing right now, you can't quite click on them, but they will be posted on our website when we post the recording. So they'll all be live in that format. And I'll just pause here for any additional open forum comments, questions, concerns. Shout outs to specific caregivers for Direct Care Worker Appreciation Week. All right. Well, with that, I'll go ahead and close us out here. Just another reminder to take my survey, to tell us how we're doing. Let us know if this is worth your time or any topics you'd like to see. It really is helpful. There's been, in fact, the open forum that we have was actually a survey request when I first started. And so we've implemented that, and it's been really helpful for folks to just have time to process and ask questions. And so the feedback you provide on there comes right to me. It's all anonymous, so you don't even have to worry about hurting my feelings. But we will actually listen to it and try to implement the feedback that you leave. So we really appreciate you taking the time to do that. Our next collaborative meeting will be Wednesday, July 8th, same time, same place. You can get information about that meeting as well as the action group meetings that are happening in between time on our Direct Care Workforce Collaborative website, which I will drop here in just a moment. It's been kind of peppered throughout the chat, but we'll make sure we share it one more time. And again, all these links that we've shared in the chat are captured on these slides. And so when they're posted to our website, all of these links will be live. And so you'll be able to access all of them instead of saving the chat, which can be a bit of a hassle sometimes. And then we like to close out with just some resources and links for things that might be helpful for you until we get back together again. And so there is our Direct Care Workforce page, Direct Care Careers that John spoke of, signing up for the OCL newsletter, stakeholder engagement calendar. We have the CDLE Direct Care page for information on the stabilization board. Understanding the impact of federal changes to Medicaid, that's kind of our HICPUF communications page, landing page for all the changes that are happening in this space and time. And so it's just a really good place to keep a pulse on, maybe bookmark and continue to check back. Medicaid Sustainability in Colorado's LTSS system, that's OCL, or the Office of Community Living specific. And so that webinar on Monday, that recording will be posted on that website. And so again, just a great place for you to bookmark and keep tabs on. And then, of course, the feedback survey that I continue to beg for you to complete for me. So just some great resources to send us out the door here. Happy Direct Care Worker Appreciation Week. Thank you for being here. If you need anything in the meantime, you know where to find us. And we just really appreciate you spending your morning with us. So thank you so much, and we will see you next time. Have a good day.